audiology, and creating the exam questions and that foundational knowledge for the field in general, how is it how is it unique from serving adults?
It's funny because every time we analyze a question as a group for the exam, we're like, is this a question that every audiologist should know? Or is this a question that if you are working with children, this you should have to know? And so obviously when we're talking about the ears, our ears are all, we could talk about anatomy and all those things, and that's going to translate from peds to adults and that whole, how the hearing system works and how our brain processes sound. You know, all those processes are the same. But when you talk about children, you can't just apply what we know about adults right over to a child and think that it's a kind of a one-to-one relationship because it's not. We have a research going on in our hospital right now regarding noise exposure in NICU and a PICU population. And one of the researchers emailed me and asked me about noise exposure levels. And in audiology right now, there's really only things published with like noise. For example, you need if you're in 85 decibels of noise, you can only have 8 hours of exposure. They've That's only been done on adult ears, and so we're talking. Can you just translate that over to giving those same recommendations for this population in the NICU? And the reality is you can't, because those ears, 85 decibels of noise exposure at 8 hours is for an adult is not going to be the same exposure on a tiny ear that has a different sound pressure level. There's just different things that are going to happen to that ear. And so that's what's really important to understand is yes, a ton of our research and all of our foundational research is based on adult ears, and that's important for every audiologist to know. But once you're working with a child, you need to have that foundational knowledge, but you have to understand how is different and how you apply it differently to a child. And I think that's what's super important for anybody specializing in pediatrics to know. You can't just take adult practice and move it over to a child.